Digital Health Institute for Transformation welcomes you to the DHIT Frequency Podcast.
Welcome friends, welcome family, welcome collaborators everywhere. Thanks for tuning in to the DHIT Frequency. I'm your host, Michael Levy. We're going to be speaking with Anika Gardenhire today. She's the Vice President of Digital Transformation for Intermountain Health. True rock star, true game changer. A lot to say, a lot of passion. Stay tuned and let's get it going. This is Michael Levy and you're tuned into the DHIT Frequency. Anika, let's keep it honest. How do you wake up every day? Why do you wake up? What's on your mind? What powers you? Why the burning platform?
So first, thank you so much for having me and inviting me, and the work that you all are doing in order to bring the willing collaborators together. I am super appreciative. I think for me, it is the real opportunity to be able to give back. I am very fortunate that I put those 5 majors on my applications for college and ended up going to nursing school and doing that on a full academic scholarship, right? And having that opportunity to get that education. And as a registered nurse, this profession has been just amazing to me as an individual. It's been amazing to my family. It gives me the opportunity to have what I think is now my life's motto, which is the ripple effect. So moving through my career and being able to impact individual patients, and then being able to grow other clinicians and have them impact patients. And now being in this place with technology that will ultimately allow us the opportunity to exponentially impact patients and consumers in a way that I don't think we are even yet to contemplate, truly. And so for me, that's the why every day. That's the, get up every morning and really give it your absolute all. And being very fortunate to be in the very serious business that is healthcare. Unlike any other industry, that is the life and the death of it. And that very serious business, I am humbled and amazed to continue to get to do the things that I do every day. So it's awesome.
Ain't nothing more real than that, right? At the end of the day, it's my joy and my connection to purpose is no different. What we found as we've continued to ring the bell here of all the whys that we collect is that we all have very, very similar purpose that aligns us, and what we do with that purpose is really the next question I want to dig into, Anika. You wake up, you got this burning platform, you have direction of intent as a human being in the morning. What do you spend your time on? What do you do? How are you making a difference day in and day out? What's a day in the life of Anika look like?
The beauty of it is a little bit different every day. And I really live for that. But from the perspective of, very similar nature of being able to grow a team, being able to surround myself with some of the best minds in data, in decision support, in clinical and content management, right? And research. And so I'm very fortunate that I get to go into a place every day where I'm surrounded by a set of collective knowledge that is really going to move the needle for multiple populations. That I get to be surrounded by a chief executive officer who has an amazing grand vision. But from an everyday perspective, it's really saying, how are we digitally transforming? How are we measuring it? How are we deriving value back to the organization from an Intermountain Healthcare perspective? And then how are we ultimately putting that value back direct to our consumer? Which makes me super excited to be at Intermountain Healthcare, right? Is because it's not just about the conversation of a sustainable organization. It's about the conversation of a sustainable population, a sustainable individual, those individuals being able to afford their care, right? And to have security in ways that we haven't necessarily imagined before around the ability to receive healthcare, around access to healthcare. And so every day I get the opportunity to help partner to guide our data strategy. I get the opportunity to help partner to develop research informatics and really make sure that we understand how technology will impact our populations and the world. I get the opportunity to talk about patient-reported outcomes and how we're going to collect that data and information and get it to our clinicians who can really use it to make a difference in an individual's life. And so every single day I get to wake up and work very hard on those things. And in full transparency, I get to experience all of the same frustrations as every other executive in a large healthcare organization, right? That is a part of life. I won't deny that. But those individual small wins and successes, I think they absolutely sustain you and keep you going.
Well, I love it. I don't know if you noticed, but I have a very close ear on two words that I feel are the easiest thing for any person to enhance their life by modifying, and you've already gotten there, so you're already doing it, so I can't give you that gift, but it just points to the type of perspective you have on each day, which is the difference between get to and have to. When you orient your vocabulary around getting to do something, life is not so arduous. It's a pleasure. When you have to do something, the world is against you, and already you're swimming upstream. And the energy and the culture and the mindset, the ability to take life and live it in health and wellness with ourselves and with our family and our friends, it's there for us. It's there to have. And it's a pleasure to listen to how you speak, because again, as you articulate throughout Intermountain and throughout Salt Lake City, and as you speak to the world, as you create your ripples, it's clear that those ripples are going to have the effect based off of the simple and the incremental, but the daily persistent and the unwavering narrative that you're working towards, that we're all working towards. So thank you, and it's a refreshing to hear that's already embedded in your vocabulary, and such a treat for all of us to actually embody is not saying I have to go pick up my children, but saying I get to go pick up my children, and those have fundamental different meanings, and so the words that we do use do matter. So thanks for incorporating that. You obviously have had before and after moments in life, those pivotal inflection points that make everything you've done up to that kind of worth it and or validating or course directing.
No, absolutely. And I think that moment, that story is, so I worked as a nurse in cardiovascular recovery. I had the opportunity to be a traveler and then to grow in operational leadership from a healthcare perspective, and then was working in California at an organization where the nurses gave notice of strike due to a system that we'd implemented in the operating room. And it was funny because I was of sort of that age and generation where I had always been like the kid who was good with computers, right? So as a nurse, every other nurse who really, really hates the computers knows that one nurse on the unit, right? And so it was really interesting to me. So being from the Southeast, I'd actually learned about documenting in the computer in nursing school. Like, we were light years ahead, and getting the opportunity to go over to the OR. By the way, I am a critical care nurse. I had up until that point not done the OR and really praised OR nurses and psych nurses and all the other kinds, but had traditionally stuck to my domain. But getting an opportunity to really go, and my chief nursing officer sort of tasking me with figure out what is happening over there. And in all honesty, it was sort of that light moment where you realize how much implementation matters, how much manipulation of the technology itself matters, how much the details matter about where you place devices in an OR suite, and what it looks like when you have a large fluoro device in that suite and when you don't. And how do you create templates that work for a 15-minute cataract case, and a nurse who in between has 10 minutes to properly position a patient for cataract surgery? And so your sort of mindset around interacting with the computer and what has to happen there in order to capture, realizing that you should be the last thing on their mind. Right. You should least amount of cognitive load in that interaction, because they should be spending almost all of their time and energy on that patient, on that consumer that's on that table. And so how do we create technologies and implement them in ways that truly respect that in our business? Really, I think was sort of the catalyst for me of that becoming a life passion and continuing to want to do that work and thinking now and being a sort of crazy, calm technology enthusiast as those books continue to be written, right? To think about how do we make this support the convenience of life and get it from the shiny to sort of the dull that's just standing in the background, I think is what I'm super excited to get to do.
I love that. I love that. And, kind of leads us into really that impact punch at the end. We like to leave our listeners and or enthusiasts out there as it relates to what we're building for. What is this all architecting to look like? We're only 1919 in the 21st century, right? 100 years ago, the car came out on the market and we didn't even have the interstate, right? And so here we are with technology coming at just, breakneck Moore's law, right? Speed of getting faster, cheaper, more accessible, deeper into our abilities as consumers. What does 5 years look like for it? What's your imagine if statement, Anika?
The beauty of what we have the opportunity to do with technology is, in my opinion, to support and enhance the things that are the most human about us, and to really give the opportunity for those most human traits to be at the forefront. And so for me, what I really hope to have the opportunity to do is to think about, imagine, and create a world where we get to do things like eliminate health disparities, right? That's something that's clearly at the forefront of my mind every single day as I think about how we implement technology. What are the ethics that surround, especially technology in healthcare, really need to look and feel like in order to create that type of tomorrow? And I think the other thing is, how do we create the type of digital and consumer experience where we can absolutely have the most human moments when we interact with other humans, right? Especially from a healthcare perspective. And so we have to think about, from an access perspective, how to concentrate those moments, how to distill them down to their most impactful. And in all honesty, we have to sort of get the tech out of the way and make it the supporting and enabling mechanism that it truly is. And so in my mind, in the tomorrow, it surrounds us, it supports us, it enhances those experiences. It looks and feels like the very high touch nature that is healthcare. But in all honesty, it allows for the most human to human interaction that we can create in the most distilled and appropriate point in time that we can actually have. And so as a registered nurse, it still just comes down to the elimination of all of the noise and all of the rest of what's happening in the room when the nurse walks in and has a moment with their patient and holds their hand and gives them some news that will impact their life and supports them through some news that they just received. And there are these capturing and enabling technologies that just allow us to record and enhance that and support that.
You're a rock star. I love it. No, that's that's what we're fighting for right now. That's the good fight. Bring humanity back to this world, bring community back to this world, bring family back to this world. We can do that by taking our autonomy back and working together to design and develop a new way. And appreciate you, Anika, for joining us today. Appreciate you for joining us on November 13th for the DHIT Summit. We are so excited and so pleased to have a family, a community that's growing of game changers, of status quo challengers and transformers like yourself. So on behalf of our community, thank you very much, Anika. And thank you, community, for turning into the DHIT frequency, where we get real, raw, and righteous, exposing our purpose and passions to build a better future now. Thank you, Anika.
Thank you.
Digital Health Institute for Transformation celebrates status quo challengers. We encourage risk-taking, we welcome change, and we like to share. So register now for DHIT's 2019 Summit, Digital Health 360, Accelerating the Future of Health. It's a full day of expert panel discussions, workshops, and networking. November 13th. Join us. Sign up today at dhitglobal.org. Click on dhitglobal.org and subscribe to all of the DHIT Frequency podcasts. Sign up for a weekly newsletter and register for the next DHIT Happy Hour at dhitglobal.org. Next week, tune into DHIT Frequency and meet Michael Rulin. His drive to reach and help the underserved has ripple effects across the future of health education.